Abortion care has been extensively studied and is safe. There are two main options for abortion care: taking medicines or having a procedure. Medication abortions use medicine to end a pregnancy. People who are earlier in pregnancy can use these medications to pass the pregnancy in the privacy of their own home. If you want to have a medication abortion, we can start that process today, after you finish this video. Procedural abortions are performed by a healthcare provider, usually in a clinic, but sometimes in a hospital. The pregnancy is removed using special instruments through the cervix. There are no incisions. People have different options for using pain or relaxing medications for the procedure. If you want a procedural abortion, we will give you information about places nearby that can provide this care.
As we said, a medication abortion is a safe and effective way to end a pregnancy. It consists of taking two medications taken as pills one day apart. The day before you plan to pass the pregnancy, you swallow the first pill called mifepristone. Most people don't feel any different after taking mifepristone. They can usually do normal activities like work, school, or childcare. Rarely, you can have a headache, nausea, or spotting. The next day, you take the next medication called misoprostol. You want to make sure you take this when you are at home or in a comfortable place. You'll need good access to a bathroom because this medicine helps your body pass the pregnancy. It is normal to have cramping and vaginal bleeding. You can take the misoprostol one of two ways. The first option is to place it between your gum and cheek and leave it there for 30 minutes. It tastes a bit chalky. After 30 minutes, swish your mouth with water and swallow whatever didn't dissolve. The second option is to place the misoprostol pills in your vagina. Put all 4 pills in the vagina as high as you can reach. Some people like the vaginal option, especially if you are having a lot of nausea and vomiting with the pregnancy. This can lower your chances of having extra nausea. About 1 hour before taking misoprostol, we recommend taking a medicine for nausea and a medicine for cramping, such as ibuprofen. You may start experiencing cramping and bleeding about 30 minutes after taking the misoprostol. About 6 out of 10 people will pass the pregnancy within 3 to 4 hours. The remainder will expel the pregnancy within 24 hours. If your bleeding doesn't start within 24 hours of taking misoprostol, that is not normal. Call us at the number we gave you. Cramps are expected during a medication abortion. The cramps are most intense when your body is passing the pregnancy. This usually takes 2 to 4 hours, and we will give you some medicine to help.
Medication abortion is safe, but any medical procedure comes with risks. The serious risks with medication abortion are rare, but fall into 3 categories. First, people often bleed a lot during a medication abortion, more than their normal periods. Too much bleeding is fully soaking through 2 menstrual pads per hour for 2 hours in a row. Please seek emergency care if you are bleeding through more than 4 pads in 2 hours, or if you have continued gushing or passing large clots that is not stopping, or you have shortness of breath, feel very weak, or pass out. Second, the medicine misoprostol can cause a low-grade fever. If you develop flu-like symptoms that last more than 24 hours or have a fever higher than 100.4 degrees Fahrenheit at any time, please call us. Lastly, there is a chance that the pills do not work. These medicines can cause birth defects, so we recommend having a procedure to complete the abortion. Sometimes people need a procedure for bleeding that stays heavy. Bleeding should get lighter each day, just like a period. It's normal for bleeding to last 1 to 2 weeks. If the bleeding is still like a heavy day of your period almost a week after taking the medicines, you should be seen to discuss a possible procedure. If you prefer an in-person follow-up visit, we can arrange that too. Some people want that because they would like to discuss birth control options.
How can you be sure that the medication abortion worked for you? We recommend a virtual or phone follow-up visit to review how the process went. We will also ask you to take a pregnancy test 4 weeks after your abortion. It normally takes this long before you see a negative result. Sometimes we may recommend an ultrasound or blood tests.